We're really excited that you're here today. And my name is Sheila Shea, and I'm from UCLA Asian American Studies Center. This program is co-sponsored by UCLA's Asian American Studies Center and the Fielding School of Public Health, LA County Department of Public Health, and the Asian Pacific Policy and Planning Council. Okay, before we begin our program, we want to start off with land acknowledgements. We want to pay tribute to Gabrielino and Tongva peoples as the traditional land caretakers of Tovangar, the LA Basin, and South Channel Islands. As a land grant institution, we pay respects to our ancestors, elders, and to all relations, past, present, and emerging. And to help us get a feel for who's here in the audience today, we want to conduct a SlidePoll that's anonymous and interactive as people are entering the room. So I'm going to stop my screen and let Melissa Koba from LADPH take over. Okay, so for those who aren't familiar with Slido, this is an interactive poll that lets us see results right away. And if you can use this, any device, you can use a phone, you can use a phone, you can use your laptop if you prefer. If you want to use your phone, you can aim your camera at the QR code. And if you want to use your desktop or laptop, just feel free to join at slido.com, and up in the upper left, it says join Slido, and use this code in the upper left-hand corner. And we see some results coming in already. Okay, lots of nonprofits right now. Keep entering your responses, please. I'll give it a very few seconds. Some colleges, universities, a few people from healthcare. And you can see the responses changing. So feel free to keep adding your responses so we know who's here. A few more from healthcare. Okay. Okay. All right, let's move on to the second question. We'll give Melissa a few, takes a few seconds to get to the next question. Next, we want to hear what languages are spoken by the clients you serve. So this is going to be a word cloud, so feel free just to type in your answer. You can type in multiple answers, obviously, and we can start to see responses from the audience as a word cloud. So feel free to drop in your answers. Swahili. Any other languages? I know there's more than that, I would imagine. Great, mostly Vietnamese, Khmer. Spanish, Vietnamese, Tagalog, Chinese, English as well, Burmese. Okay, keep sending your answers in. We're up to 11 only here, so I know there's more people here who can respond. Great. Okay, maybe a few more seconds for any responses. Okay, for those of you joining late, you're welcome to join our poll. We just have 2 more questions at slido.com. Just use your QR code and aim it, take your phone and you can aim it, your camera at the QR code, or you can go you can open another tab in your browser and go to slido.com and enter the question, the code in the upper left-hand corner where it says join Slido, join participating Slido. But you know, it's fine if you just want to drop it in the chat and you're not able to access it, it's fine as well. Okay, great. Let's move on to the next question. Okay, what type of information is most needed for translation? So this is an open-ended question, so if you can put in short phrases, This helps us understand what the community needs are. So an example might be vaccine FAQ or vaccination location information. Any information that your diverse communities need for translation. Just want to see some responses here that can help inform our work as well. Video format. Vaccine information, yes. Okay, flyers, infographics, great. More responses here. Okay, verbal translations because people cannot read or write. Bystander intervention training, good to know. Safety of different vaccines. Mental health advocacy. Okay, there's a lot of information here, and it's great to see this variety of information that's needed. This is really helpful. Thank you. We'll give a few more seconds. Feel free to add multiple responses. Testimonials by AANHPI faith leaders. Thank you. We've heard some of that as well from our community members. Okay. Okay, for the sake of time, we'll move on to the next one. Thank you for responding to. We'll move to our last one quickly. This is a multiple choice question. Okay, last question. What channels of information have been most effective in reaching community members? So feel free to choose more than one option. And then we'll see the responses, most common responses bubble up to the top. So is it social media? How are you reaching your community members? Is it through telephoning? Okay, a lot of ethnic media, some social media, canvassing as well. Less texting, but lots of phone calls. Okay, this is very interesting and helpful for us. Thank you. A few more seconds to get some more responses in. Okay, one-on-one TV. Okay. Great. Okay, we know ethnic media is a primary communication strategy, so social media as well. Okay, wonderful. Okay, so let's dive right in to our agenda and our panelists. I'll share my screen. So for our panelists and experts, we're really lucky to have a well-rounded group here, and we thank our panelists and experts for being here. We will have Dr. Xiaofeng Zhang, Dr. Zhang is a professor of epidemiology from UCLA Fielding School of Public Health. We have Jocelyn Estiandan from LA County Department of Public Health, and she's a senior public health analyst. We have Professor Mei Wang from UCLA Fielding School of Public Health. She is one of the initial collaborators and designers of our TranslateCovid website. And Daniel Kim, our programmer, he is also from UCLA Asian American Studies Center. We have Michelle Wong from Asian Pacific Planning and Policy Council. We have Zhang Yu, program coordinator for the Asian Youth Center. And again, I'm Sheila Shea, project coordinator from the Asian American Studies Center. Okay, let's look at our agenda. Here's our agenda for today. We want to start off with an overview and demonstration of TranslateCovid. And then Jocelyn Estiandan from DPH will present COVID-19 communications and for Asian Americans, Native Hawaiians, and Pacific Islanders. And she'll share from some very interesting findings from community-based organizations. Dr. Zhang will speak about COVID-19 variants through our Q&A session. So we'll spend some time talking to him. At that point, we'd love to have some people, have anybody interested in dropping questions in our chat for Dr. Zhang. Then Michelle Wong from APCON, Program Director, will talk about the County COVID-19 Community Health Worker Outreach Initiative and the Equity Fund. And then we will hear from Zhuanyu Zhu from the Asian Youth Center, and she's going to be sharing in-language materials and outreach about how she's using in-language materials from DPH and to reach her community members. And then we'll finalize with the feedback and Q&A session. And at that point, that's where we'll take questions from the audience. So we'll hold off on answering questions at the very end. But if you do have questions that come up along the way, feel free to drop them in the chat. We're going to spend the next few minutes looking at our website for TranslateCovid, but we wanted to emphasize a few key points before we dive in. Our overall goal with TranslateCovid is to help reduce the spread of the virus. Therefore, vaccine and outreach remain important, even as cases and death rates decrease. For the past month, we know that vaccination demand has slowed, and that CDC reports that we're now an average of less than 1 million new doses administered per day in the US. And that's compared to an average of 3.2 million in April. So it's still very important to encourage vaccinations for a number of reasons. Among them, number one, we need to slow down the new variants. And that's not just to protect against transmission, but to keep the virus from mutating and developing new variants that could be more infectious. We also know there's some hesitancy around the Black and the Latinx community, and within subgroups of the AAPI community that's often overlooked. And so that's why we need to listen to concerns, help to address their questions. And we'll hear more about the concerns from the AAPI community later in the program. And lastly, we're at a critical juncture as California is about to reopen on June 15th. And to limit the spread, there are still precautions we need to take, even though we're all very excited to be amongst friends and families and go back to normal life. There's still precautions we need to take. And we still feel we need to continue to provide materials to our most vulnerable populations and really find ways to reach them where they're at. Okay, and that said, I'm gonna stop sharing my screen and, oh, actually, no, I'm gonna jump into one more slide, sorry. Before I let Daniel take over, I want to give you an overview if you're not familiar with our website, translatecovid.org. This is really a joint effort between Asian American Studies Center and the Fielding School of Public Health. We currently have 50 resources. We have resources in over 50 languages, covering various topics related to COVID-19. And we're an aggregator, so we scour the web for relevant and credible in-language material. We look for credible resources that have health expertise, such as CDC, LATPH, and accredited universities. And lastly, we have a vetting protocol for reviewing the hundreds of resources and websites we consider. This was developed by Professor Mei Wang, who was on our panel today. And we continually review materials and we vet them with the help of center staff, student interns, and many volunteers. Okay, and then I will stop sharing my screen and let Daniel take it away.
Hi, Sheila, thank you so much. I'm gonna go ahead and share my screen, just a moment. And I hope everybody can see this. We're currently on the TranslateCovid.org website. Again, my name is Daniel. I'm one of the programmers involved in the development of TranslateCovid.org. And I'll be happy to do a brief walkthrough of the website. And for those of you who have seen this before, I'll also be able to point out some major changes that we've made based on a lot of user feedback. As we take a look, right off the bat, you'll notice that the site already looks very different from before. And that's because the search bar has been removed. One of the key challenges we found was that folks who didn't speak English had a tougher time navigating and properly searching through all of our database resources. So what we've done is just, we've tried our best to greatly simplify and streamline how an individual can access all of our resources in our database by simply clicking on the respective language. And we'll be back to see an example in a moment. Okay, next we have a link that points to the CDC website for individuals looking for vaccines in a particular area, followed by a new addition to our Slow the Spread section, which has content geared towards educating the public on safety measures against the coronavirus. We feature videos and a brand new FAQ section, which were created as a joint effort between the Asian American Studies Center and a partnership with the UCLA Fielding School of Public Health. We are aware of the potential changes of some of the content, and we'll be actively updating this section to coincide with local and federal health guidelines. Okay, clicking on the vaccine FAQ card, you'll find, in addition to the frequently asked questions in English, icons for any languages that have translated versions available. These initial set of translations were prioritized to address the diverse and at-risk communities that we serve here in Los Angeles. Now, let's go back home and take a look at an example of accessing our database resources. For this example, we're going to take a look at Korean. Okay, so notice at the top of the results, we get a copy of the translated vaccine FAQs, if available, followed by videos in the respective language. And last but not least, we now have the vetted COVID-19 resources that are being pulled from our database. I'd like to point out that our database resources still provide information in what we like to call paired resources, meaning that an English version of a resource will usually accompany the in-language version. We believe that this method helps bridge both the language and generational barriers when it comes to educating the public about the fundamentals of this pandemic. And if you happen to come across a great resource you'd like to share with someone in any language, this makes it very easy to verify the content for accuracy so you can share with confidence. And speaking of sharing responsibly, you'll find social media share buttons on the right side of the screen that will conveniently generate a post for the page we're on to a wide selection of social media platforms. And for the final portion of this demo, I just want to cover some new information we have on the navigation menus. First, taking a look at Learn and Share. Let's take a look at that. So here you'll find content that has been revamped for increased legibility. And you'll find that our social media toolkit is located under the Share COVID-19 Knowledge tab. Next, our Resource Center. We now include information on where to find vaccines, and in our video section, we are continually adding engaging content to our videos to help educate the public about vaccines in different languages. Last but not least, our anti-hate section has been updated with a significant amount of new information, and they have been categorized into 5 major categories of information. We have hate incident reporting sites, and we also have anti-hate campaigns and toolkits, research reports, educational resources, which includes a new project that we just launched in response to the increasing attacks against Asian Americans, and more. That concludes our brief walkthrough of the site. I'd like to thank you for all of your time and attention and encourage you to visit TranslateCovid.org to browse through a wide range of resources for your communities. Thank you.
Thank you very much, Daniel. Next, we will have Jocelyn Estiandan from LA County Department of Public Health, and she's presenting on COVID-19 communications for Asian Americans, Native Hawaiians, and Pacific Islanders.
Thanks, Sheila. Can everyone see my screen okay and hear me okay?
Yes.
Wonderful. Well, hello, everyone. Good afternoon. Again, my name is Jocelyn Estiandan. I'm with the Department of Public Health. I am so happy to be here and to present what we've been up to since our last webinar in December. So for those of you who joined us back in December, I am going to cover some of very similar information, but some updates as well. During my presentation, I'd like to share the collective effort of several community partners who regularly come together to help develop COVID-19 materials targeting our Asian American communities. and who come up with outreach and education strategies to reach these diverse communities. During the presentation, I'll also let you know how to access the materials we've developed, as well as other translated DPH materials and where you can find other reliable information. The Asian American, Native Hawaiian, Pacific Islander COVID-19 Task Force was formed from the AANHPI Health Initiative. The Health Initiative, now the Health Committee under the Asian Pacific Policy and Planning Council, or APCON, is a group of community stakeholders who have worked in partnership with public health since 2013. When the pandemic hit, they decided to pivot and focus their collective efforts to address the needs of Asian Americans in our community. The communications subcommittee is one of 4 that formed. The other 3 were data information disaggregation, road to recovery policy and resources, and fundraising. The task force wrote a letter to the DPH health officer with a number of asks, the first of which was to improve accessibility, outreach, and translation of COVID-19 materials and information for our AANHPI communities. So this is what this group seeks to do. And while our Native Hawaiian and Pacific Islanders are included in the goal, I do want to clarify that this subcommittee focused on the Asian American communities because there was already a lot of great communication efforts coming out of the Southern California Pacific Islander COVID-19 response team, and we're in many ways ahead of this group. So materials were developed for the NHPI communities with the response team, but not from this subcommittee. And here's a list of some of the groups that are represented in our subcommittee. We have representatives from each of these agencies, and I'd like to thank all of them for their time and dedication to being a part of this group. One of the ways the group thought to improve accessibility, outreach, and translation of COVID-19 materials was to develop material that addressed the specific needs of our communities. So we tried to hone in on messages that would remain relevant for the duration of the pandemic. So we did develop these infographics, and on the front side, we included reminders of how to stop the spread of COVID-19. We have encouragement to seek timely care, being wary of misinformation, which was very prevalent in our communities, and encouragement to maintain regular preventative care. On the back side, we listed resources that reflected the top community needs and concerns. So we do have phone numbers, websites for how to get help for unemployment claims, mental health, food assistance, health insurance, cash aid, domestic violence resources, conflict resolution, and where to report hate crimes. And these materials were translated into the 8 Asian languages you see here. I would also like to highlight the parallel efforts that took place for the Native Hawaiian and Pacific Islander communities. Staff from our Center for Health Equity worked with the Southern California Pacific Islander COVID-19 response team to develop this fact sheet. Another way the subcommittee helped was by participating in a listening session on COVID-19 vaccine. This was held back in January with about 20 participants. A series of questions and images were presented for participant feedback. I'm sure many of you on this call may have even participated in that back then. We didn't limit the listening session to members of just the subcommittee, but we opened it up to others who wanted to join. And the information we gathered there has helped inform some of the materials that were developed. Some of the concerns that people expressed was that community thought that the vaccine was developed too quickly, not being familiar with mRNA technology and the use of fetal cell lines. They were concerned about vaccine effectiveness and representation of Asians in clinical trials. DPH did produce materials that address some of these concerns, namely a very comprehensive FAQ document, and one specifically around the use of fetal cell lines. In the development of the vaccine, fetal cell lines in the development of vaccine. We know that this was particularly important for our Asian Catholic and Christian community. So these materials are available in the languages that you see here. And a little later on, I'll tell you how to find these. Some of the strategies identified to increase vaccine confidence was to ask trusted leaders to be our messengers. So representatives from community-based organizations, faith-based groups, healthcare providers, teachers, peers. Folks thought it would be best to communicate through ethnic media and social media, and I think that was reflected through the poll, the Slido that we did earlier today, and to make our materials obviously easy to read. They thought that use of incentives also might help, which the state, as you've heard, has taken the lead on, and the use of pop-up mobile clinics in high traffic areas. Some of these have been done in our communities in Chinatown, historic Filipino town, Carson. I do want to take the time though to let you know about a link on our website if your organization would like to set up a mobile vaccine clinic. This is a direct link, but if I could very quickly navigate you to where you could find this on our website. Can everyone see? Last time I jumped to a website, you didn't follow along, but can everyone see our vaccinatelacounty.com website?
Yes, we can see
Thank
the
you.
website.
Thank you. Thank you. Thank you. All right. So if you go to vaccinatelacounty.com, if you scroll down at the bottom of these, this red list here, it's find a vaccination provider for your organization. If you click here, these providers have actually put their contact information out there if your organization wants to partner with them to set up a vaccine pop-up clinic. If you want to work with us, public health, if you click on this link here, it actually comes up to a form in which you can fill out to say all the information that you'd like, about a possible vaccine clinic that you could co-host with us. So I did want to share that information with you all, since we do have an audience that might specifically target our Asian communities. And if you have the ability to partner with one of these providers to create a pop-up vaccine clinic, we highly encourage you to do so. All right. The subcommittee is also working on different ways to convey stories. We know that stories resonate with people, so we're looking into developing a series of comic strips with COVID-19 vaccine messaging targeting our Asian communities. I'm curious, you could just put it in the chat whether you think this might be a good idea, a bad idea. What I have here up is an example from the Global Outbreak Alert and Response Network from the World Health Organization. I'll leave this up just so that you could read it, but it's just something that came out, I think, early in the pandemic. It's a way, I think, comics was brought up in one of our subcommittee meetings as maybe being another way to convey information and education to our communities. Reading, paragraphs of information or even infographics, people sort of have seen that, and we thought that this might be a creative way to get the information across to our communities. So I'd be curious if you think this might be a good idea. Just leave your thoughts in the chat, and then maybe we can have a little discussion afterwards when we're in the Q&A. But this is something that we're exploring, and to have public health work with our communities on this. We have gotten a lot of questions around vaccine and pregnancy. So these fact sheets were developed very recently. They address the risk of COVID-19 infection among those who are pregnant, and the vaccine impact on fertility, in which there is no evidence that shows COVID-19 vaccines decrease fertility, and with breastfeeding, in which they are thought to not be at risk for lactating people or their breastfeeding babies. And these fact sheets are available in the languages listed here. So where can you find these materials on our website? Many of our materials have been translated, but you have to know what you're looking for. On our DPH COVID page, this is different from our vaccination page, with the link shown here, go to the section called Guidance, and then in the drop-down IMA, select Individual, Family, and Specific Group, and that will jump to the area of the page where you can find the infographics that I showed earlier. And I'll make these slides available to all the participants on this webinar. We also created in-language web pages that house all of the materials that are translated into the 13 threshold languages of LA County. And so that's at the very top of our COVID-19 webpage, and you can see that here. There's a scrolling banner on the left that scrolls through to say that the information is available in these languages. These pages are completely in language, so you can forward the link to stakeholders who may be in need of the information in that specific language. And to clarify, these are not Google translated pages. These were done by professional translators. For vaccine materials specifically, you have to go to our vaccinatelacounty.com website and look to the bottom left panel, that area that I showed you earlier. When you expand those plus signs, you'll see all the materials there and their translated versions. We also have a toolkit. This is from the County of LA. This toolkit features a library of creative content, from social media graphics and video PSAs to written posts, and they are available in English, Spanish, Korean, traditional Chinese, and Armenian. And this particular toolkit makes it easier for you to share on social media platform using a one-click share button directly on the toolkit site. I mentioned earlier the communication efforts of the Southern California Pacific Islander COVID-19 response team. Please do check out their website as well. They do have in-language materials, including this amazing toolkit and many more things. Another great place, of course, to find reliable information is on TranslateCovid.org, which you heard about earlier. UCLA has been a key partner with us in having our translated materials available for our communities. And finally, many people may not know that the CDC does produce a good amount of materials that is translated in other languages. If you go to this website, you'll see you can actually search by topic and then by language. And you can also search by language as well. That brings me to the end of my presentation, and we will, I believe, take questions at the very end. Thank you.
Thank you very much, Jocelyn. Really appreciate you sharing all the important work LADPH is doing to really reach our most vulnerable communities through education outreach. So thank you. Next, we are going to introduce Dr. Zhang, Distinguished Professor of Epidemiology, Associate Dean for Research at UCLA Fielding School of Public Health, and Director of Molecular Epidemiology Training Program. He also serves as a member of the NIH Cancer Epidemiology Project Evaluation Panel, and his research focuses on molecular epidemiology of cancer. Dr. Zhang was a consultant for the prevention and control of chronic diseases at the World Health Organization, and is recognized internationally as a renowned public health expert. And we are just very excited to have Dr. Zhang join us today. We're lucky to have him here. Variants are top of people's mind and have many questions. So thank you, Dr. Zhang, for joining us.
Thank you very much. I'm so happy to be here to share my, some of my think about the new mutations of COVID-19 virus, as well as the vaccination. So if you have any questions, I'd be here to answer your questions.
Great. So I encourage you to drop any questions into the Q&A. But before, as you're doing that, give it some thought, and I'll ask Dr. Zhang a question that I think is quite common and is coming up quite a bit for lots of people. Dr. Zhang, are the new variants more contagious?
This is a very, very good question, because first we need to understand what is the variance, and the variance is caused by mutation. The mutation is caused by the change in the genetic sequence of the virus. When we compare the reference sequence, such as the original one from Wuhan or the one from Washington, the first case, the genetic sequence. So then we see mutations, and most of those mutations has no consequence, but some of the mutations really has some impact and being circulated in the population. So then we call it the variants. And it's I think it's about 1,000 variants in the population circulating in the whole world. However, it's still have only a few very important variants of variants, which is more harmful, is more infectious disease, and may cause more serious disease. So basically, if I answer your question directly, yes, they're much more contagious. For example, the majority of the variants in the United States is the one from UK, which WHO called alpha. This alpha type, compared with the original one, the transmission increased about 50%. It's much more contagious. And the second one is the beta, which is from South Africa. is also 50% more. The third one is from India. This one we call the Delta, which in fact in the United States is we don't have many. We only have like 2.5%, and this one is very, very contagious. So it's over, as reported from China, it's about at least doubled of their ability to be transmitted in the population with very short latency, and the transmission rate is much, much higher. So this is the question. I think yes, most of those mutations or variants are more contagious.
Thank you, Dr. Zhang. Feel free to drop in any questions for Dr. Zhang, but I do have a follow-up question to that. Given that these variants are quite contagious and different degrees for different ones, will the current COVID-19 vaccines work against some of these variants?
It seems that, according to the report, I can see it seems that the vaccine is effective in protection against most of the variants, including the most infectious variant, which is the Delta, the India one. But the protection rate is slightly lower compared with the general infection. So there was a study by Public Health England. I think it just being on. Has not been published yet, but being posted on the website. And they found if you have one dose of the vaccine, the protection rate is about 33% for the India virus and 51% for the England virus. So basically, it does have the protection, but the protection is slower than the protection we observed in the phase 3 trials, as well as in the real population, real world data. However, if people get complete vaccines, which means 2 doses, which the protection is much higher. For example, for those people who has complete vaccination, the protection rate is 81% for India virus, for Delta type, and 87% for Alpha type, which is the England virus. So basically, yes, there's a protection right now. And for those people who only had one dose, I would urge you to get the second dose because the protection will be largely increased. And also for those people who has not get your vaccine yet, I really encourage you to get your vaccine, because if you get this variant type, the high risk type, and there's a chance, your chance, there's a chance to get the disease and also the chance of the death.
Thank you, Dr. Zhang. So we have a question here. So someone asked, will we need boosters to help protect us against these variants?
Of
How do
course.
they work?
Yeah, of course. So right now, because we have a lot of different type of variants, and a booster probably is possible. And according to my judgment, those the outbreaks, the transmission of the disease is going to be continued, not being stopped very soon. I mean, in the whole world. In the United States, that's a different story, because we're going to, open up the society and in the middle of June, and our vaccine rates are quite high. The problem is that if some proportion of the people who don't get the vaccine, and then they have a high chance to get this variant type, and will produce more of the virus type of the virus. The second thing is about how long the immunity is going to last. For example, we had a vaccine, complete vaccine, over 42% of the people in the United States get the completed vaccine, and we don't know how long it's going to last. So far, we don't know yet, but according to a lot of scientists, this probably would last over a year or more. But go to the end, the most early people who get vaccination is December, right? So I think at the end of this year, probably those first line medical doctors or people in the essential work may get a booster because the antibody we got, probably if they don't last for longer time, then we might need a booster. And also, this seems to me this might be a kind of things like a flu shot. Every year we have to have one booster, then to keep going on, because a lot of areas in the whole world still has outbreak. And with a more outbreak, then you have with a more mutant type, then more dangerous variant will be, becomes a dominant type, and which actually bring us some kind of risk. Yes, I think it's going to happen with the boosters.
Okay, thank you for answering that. I think that's been on a lot of people's minds. So thank you for addressing that. We do have a question from the audience. Another question: is black fungus COVID here, and will vaccination prevent it?
Could you please?
Question is black fungus COVID here, and will full vaccination prevent it? Black fungus COVID.
Oh, yeah, but till you choose the COVID, the vaccine may not only to be specific, but sometimes they also offer you some type of we call it general immunity. So basically, for a lot of the coronavirus, and they may also have some degree of the protection, but those are probably need to have the real study to study that. At this point, I don't think I can answer this question.
Okay, we have one more question. I think this will be our last question. When do you anticipate vaccine releases for children under 12? Are they even more at risk for variants and new mutations?
Yeah, right now we see, some of the variants, in fact, they actually attack the young children, and seems like the Pfizer already started to test the vaccine for the children under 12. And I think this population, the children need to be protected, and especially in this virus. But I don't know what would be exact the timing, because less than 12 years old is also accounts for high proportion of the population, and we're talking about achieve the herd immunity, which is 70 to 80%. Without including this group, we may have difficulties to achieve our goal to have a full herd immunity.
Thank you, Dr. Zhang. Can you also tell us about the side effects of the vaccines and how what the various side effects of the vaccines are?
I think the major side effect are kind of some people has a fever, local. You have a right arm the vaccine, you have some pain there, and sometimes you feel you have a fever. In fact, you don't have a fever, and you measure it as a lower fever, and but they do have some serious side effects, which happens in the European countries as well as in the United States. But that the proportion are quite low, which some people has symptoms of the heart, symptoms of hypertension. Some people get a stroke, and this may happen, but the proportion is relatively low, and compared with the what happens without vaccine, which would be very much similar. So I think most of people fear don't have much side effect, but I think commonly is a fever and the local pain. I think that's what happened. And also, when you have this happens after your vaccine, it's better to have a rest. Don't work too hard. Drinking more water, and to make yourself comfortable and relaxed.
Okay, wonderful. Thank you. Okay, we have time maybe for just one or two more quick questions. Dr. Zhang, a lot of music festivals are planning on occurring in the near future, music festivals and big events. What is your opinion on these super spreader events?
Tell you truth, the society is going to open in June, in the middle of June this month, in a week or two. The problem I have is that we probably relaxed too fast. CDC kept telling us, said, if you double completed your vaccination, you don't need to have wear the face mask. And here we're told to open our society, to have a musical, whatever, large people's gathering. I'm afraid, if this happens, we as I would advise you to try to avoid, because I think social distance still protect you. No matter you had vaccine or not, you still have to practice those common, the protective measures to prevent the virus to infect you. And so I think this will pose some risk for the society. So I'm not sure we should attend, but maybe I'm too strict.
Okay. Well, we have one final question. We appreciate the audience asking some very good questions. The last question is, will there be any long-term complications from the vaccine with clients who have autoimmune disorders?
I'm not sure, because this needs to be observed. The clinical trials, the phase 3 clinical trials with a large number, with 35 to 40,000 people, and they did not have a longer observation, right? Because when they finished their trial, it's only the second injection, the 2 weeks after second injection. So this kind of trials may not be able to observe the long-term impact, not only on the people with immunodeficiency, but also on others. So after this vaccine being used in the population, especially we call the real world experience, we still haven't had a sufficient time to observe if this vaccine has a long impact on any of the side effects. So this may need some time to observe. So it's hard to, at this point, to make a judgment on this question. So
we appreciate your insight and expertise, Dr. Zhang. Thank you very much.
Thank you very much for inviting me. Yeah.
It was a very informative session. Thank you. Okay, so now we're going to move on to our next speaker. And our next speaker is Michelle Wang. She's the program director for the Asian Pacific Policy Council, Asian Pacific Policy and Planning Council. And she's going to be talking about the Community Health Worker Outreach Initiative and the Equity Fund. And I will let you take it away, Michelle.
Great, thank you, Sheila. Hi, everyone. My name is Michelle Wang, and I am the Program Director at the Asian Pacific Policy and Planning Council. For those of you who don't know, APCON is a coalition of over 40 community-based organizations with over a 45-year history advocating for the rights and needs of the Asian American and Pacific Islander community in the greater Los Angeles area. And I'm just going to provide for you a overview of the health grants that we are currently receiving to provide COVID-19 related services and outreach. As a lead agency, APCON partners with community serving groups who provide support-based services in under-resourced Asian American and Pacific Islander communities. The COVID-19 Community Equity Fund, supported by the Public Health Institutes, Together Towards Health Grant and LADPH, strengthens vaccine access and uptake through outreach, engagement, education, and systems navigation. Providing culturally appropriate and linguistically competent services, APCON has partnered with community health workers in over 12 neighborhoods across LA County to provide vaccine support services in the Thai, Cambodian, Filipino, Japanese, Korean, South Asian, Chinese, and Samoan communities. And we have provided services in Tongan, Samoan, Cantonese, Mandarin, Khmer, Korean, Thai, Urdu, Hindi, Punjabi, and Bengali. We have also facilitated mobile vaccine units through our partnership with the LADPH in numerous communities to further increase uptake and vaccination rates amongst the most difficult to reach populations, such as the elderly, low income, limited English proficient, immigrant refugee populations, and non-mobile populations. APCON is also a grantee of the Public Health Institute's WeVax grant. And through the WeVax project, our partners promote awareness and increase access to vaccines with populations who are least likely to have access to high quality healthcare and who may have high rates of vaccine hesitancy. And what we are learning is that because of the focused efforts of community health workers, we're really understanding the strategies and the key factors driving vaccine hesitancy amongst the AANHPI communities. And then lastly, APCON was recently awarded a grant with the Community Health Worker Outreach Initiative, which is also a project in partnership with the LADPH. This is the third iteration of the project in which APCON has participated in. And between January and February, March of this year alone, our coalition of partners and community health workers were able to reach over 43,000 individuals and provide crucial information about COVID-19 and the importance of vaccines. This round, we are participating, partnering with over 11 community-based providers and supporting 30 community health workers as we continue our outreach and broaden the scope of our services. And with that, that concludes my section of this panel, and would like to turn it over to Zhang Yu of Asian Youth Center, who will talk to you a little bit more about the importance of in-language materials and outreach.
Thank you, Michelle. Hi, everyone. This is Xuanyu Zhu. I'm the program coordinator with Asian Youth Center, AYC. Let me share my screen. So AYC, our mission is to employ low-income immigrants and at-risk youth of all communities to overcome barriers to succeed through the provision of culturally and linguistically competent education, employment, and social services. We want all youth can succeed in school, at work, and in life. The population we served is low-income immigrants, diversion, probation, reentry, homeless, and foster youth and their families, young adults and individuals with a special cultural and linguistic competency, such as Chinese, Vietnamese, Spanish, and English with the Asian and the Latinx immigrant communities. We provide services in San Gabriel Valley, East Los Angeles, South Los Angeles, and Antelope Valley areas of LA County. For the overall COVID outreach strategies, we have online workshops or presentations, phone banking, emergency food program, youth and family services, and also the social media posts. So I'm the COVID program coordinator, so I hold Chinese language COVID online workshops once a month. AAYC has, we use WeChat. So we have a WeChat group with over 300 Chinese community members. We always share all recent COVID information or flyers in the group. We announce the workshop date and time so that members can sign up freely. The workshops contain 3 major parts: the case numbers, incidents, death numbers, all the health orders, and the vaccine information, and the last always come with the Q&A. So members might ask any questions or concerns they have, and we will try our best to answer. All the materials and the information I use in the presentation, they are all come from DPH. And the phone banking. Phone banking, we had phone banking 4 times a week. We use a talking script that comes from Microsoft Team Training Hub, but it has the English version only originally. So we translate it into Chinese and Vietnamese. So we use this talking script during the phone banking. Our phone bankers can speak friendly in Chinese, Vietnamese, and English. During the phone banking, we give our most recent information about vaccine, tell residents where they can find the resources such as the DPH website, what the website links they can use to make the vaccine appointments, and the 211 hotline, and any other like food or where they can get hygiene stuff, hotline informations. And also we answer questions and the concerns that residents might have. Another major one is the emergency food program. Before the pandemic, our emergency food program distributes food only once a month. After the breakout, we noticed the larger needs of the food and the hygiene items. We partner with LA Regional Food, the Humboldt Teachers Association, and the many other local community members and partners to meet increasing need for food. We also receive personal protective equipment and the personal hygiene items from APCOM and order the informative flyers from DPH. We put the PPEs and the flyers together with the food in the food bag and distribute to low-income families during the pandemic. And now the emergency food program, we distribute the food bag almost 3 or 4 times a week, and all weeks in a month, we distribute all. So as of March 2021, we have distributed over 400,000 meals to low-income families from 2020 and 2021. And within, we are able to put flyers and mask and hand sanitizers showing this picture, the food bag with the flyers translate. We ordered Vietnamese, Chinese, Spanish, 3 languages, and we will distribute the languages according to the clients, what languages they speak. And there's a mask and the hygiene stuff. We put them all in the food bag and giving them out. In that way, we are able to contact a lot of residents. This is a little success story from our client. She said she loved to come to AAYC to pick up food, that because all the flyers, handouts we use, they are all in language. She speaks Chinese only, cannot understand or speak English at all. So we provide everything in Chinese. Also, we have a staff can speak Chinese, so she's able to communicate well and receive the food, understand the information, and receive the essential information about the COVID from us, from AYC. This is the social media post. We have Facebook, Twitter, and Instagram. We always post the information about COVID in 3 languages: English, Chinese, and Spanish. So the COVID-19 is under our AYC Community Outreach and Education Program. We provide information, education, and emergency food services to many youth, families, and adults. We reached more than 25,000 community members with educational information through in-language press coverage and community event outreach on a variety of topics. So this is a list of many different community programs we have. But the biggest one will be the COVID-19. So starting November 2020, we are able to reach more than 19,000 contacts since November 2020. And we're able to give out information in Chinese, Vietnamese, Spanish. So, and also we are able to encourage the residents to take the vaccine. And that will be end of my presentation.
Thank you so much, Zhang. Thank you, Michelle, as well. We really appreciate hearing how community-based organizations are reaching our most vulnerable communities through all the materials on sites such as DPH and TranslateCovid. And it's really exciting to hear that, how you're reaching communities where they're at. And we appreciate all that you do in reaching them. So I think at this point, we are actually at the point of our feedback and our Q&A session. We hope this is a good opportunity for you to ask any of our panelists questions, and feel free to drop it in the chat and let us know if you have any questions you didn't get to ask throughout the presentation. We want to also ask you, community members and audience, how might you be able to use the resources you saw today in your work? Okay, we have a comment. Really appreciate the in-language materials, especially inclusion of Pacific Islander materials. Thank you. Yes, I think DPH as well as TranslateCovid have worked hard to include languages, Pacific Islander languages. For TranslateCovid, we have we work with eWeb Translator, who have staff that can help us with translations in Pacific Islander languages, and we know that there is a great need to inform and educate and to do outreach. So that is definitely something to work towards. And I see that you'll be using translated materials to develop social media graphics. That's wonderful. COVID-19 translation and DPH different languages. So another comment. We have a question here. Where can I get desegregated, or I think disaggregate COVID-19 vaccination data on the AAPI community? That's an excellent question. Jocelyn, I don't know if you want to take that question. I know it's a difficult question.
Yes, so we actually have a subcommittee working on this very topic. It is a challenge to get disaggregated information. The county is trying our best to take what we have and see what we can make public, but a lot of the data that we have is from the state level, and the state currently does not disaggregate their data. So it's been a challenge. So we do need folks from the community to also advocate at the state level. I know it's actually been brought up at the national level for the need. I think now is the time to really advocate for data disaggregation, especially amongst our Asian American, Native Hawaiian, Pacific Islander communities. There is a lot of data that the NHPI Data Policy Lab from UCLA has collected. If I can find the link, and I will share it on the chat, but there is a lot of data that they have made available. They've worked really hard to get that, that information available, but it is something that we're all currently still working on.
Yes, I agree. I think there's a great need, and the more we advocate and we more vocalize that we need disaggregated data to reach our communities. We know that the data that's reported out there on vaccination and COVID really just lumps, puts together the Asian American community, API community, Native Hawaiians in one broad category. And we know that there are differences. We know there's disparity in vaccination and positivity. And the more we ask for disaggregated data so that we can look at those different subgroups, ethnic subgroups, and address their specific challenges, that's going to benefit the community at large.
And Elise did put the link to the dashboard, the NHPI dashboard. So thank you, Elise.
We think we really, I want to really thank our audience for joining us and staying with us. We really do appreciate that. We really hope this is a helpful and informative session for you, and you've taken away some tools, resources that you're able to bring back to your community, perhaps some new information about variants and vaccination that you can share with community members and your staff and colleagues. And I want to give a big thank you to our panelists and experts who shared with us today and shared their work and talked to us today. Thank you so much for your time. And I want to personally send a thank you to TranslateCovid team at UCLA Asian American Studies Center. Thank you for all your time and effort to really put this webinar together. It was definitely a group effort, and we really appreciate it and couldn't have done with everybody on the edit team, and Melanie and Barbara and Meg and May as well, and Karen and Gil and everybody, and Tom, who's done great work on TranslateCovid. Okay, well, thank you very much, everybody. We appreciate everybody's time, and we hope you have a great day.